In this video, you'll learn to differentiate among the different types of fractures. One way fractures are classified is whether the bone breaks through the surface of the skin. If the fracture does not involve a bone breaking through the skin, it's known as a simple or closed fracture. In contrast, an open or compound fracture does involve a bone fragment tearing through the skin surface. This is a more complicated fracture to treat because there's also the risk of infection. In a transverse fracture, the break is 90 degrees relative to the length of the bone. In contrast, an oblique fracture is at an angle other than 90 degrees relative to the length of the bone. A spiral fracture occurs when bone segments are pulled apart by a twisting motion. Comminuted fractures occur when there are several breaks resulting in numerous small fragments between two larger pieces of bone. An impacted fracture is when one bone fragment is driven into another. A green stick fracture occurs when only one side of the bone is broken and the other side bends. This occurs more often during adolescence because the bones are more flexible with a higher amount of collagen fibers and less hydroxyapatite. This is called a green stick because it's similar to how a young twig will bend without snapping. A compression fracture is when a bone is crushed. Typically, this affects the bodies of the vertebrae and is much more common in patients with osteoporosis. An avulsion is a fracture that occurs when a tendon or ligament tears a fragment of bone away.